has been in this industry for many years, working with families and helping people get into treatment. Andy has been an advocate for mental health and addiction with Crosscheck Radio and through his own experiences. And I am a person in long-term recovery and the founder of a sober home for women on the Cape called Brady's Landing. We put this podcast together because the three of us are very passionate about reducing the stigma around mental health and addiction. We believe the more light we shed on these topics, the less people will stigmatize and otherwise punish those who suffer from these diseases. And we hope the information we provide and the topics we discuss will help encourage people to seek the treatment they need. Okay, so let's turn it over to Andy.
Hello, everybody. Happy Friday.
Hello.
Happy Friday.
Hello.
Happy Friday.
Happy Friday. Everybody good?
We're all good.
All right.
All good.
I know in this weird time, and we got a great guest today. We're going to have Robin Houston Bean, who we're going to introduce in a minute. Chris will tee that up for us. But in the meantime, interesting article. It's a little late. I found it about 2 weeks ago. Or I just found it, but 2 weeks. It came out 2 weeks ago. And it's kind of interesting to help address the mental health and substance abuse issue that's currently plaguing our country, and that is rising. There is an article from Health Affairs saying, and that came out on July 9th. I'm surprised I just found it. Incorporating mental health and substance abuse screening into COVID-19 contact tracing. And the article says, in the face of the global pandemic, a key first step in returning to normalcy involves contact tracing, identifying who has COVID, who has been exposed to the novel coronavirus, and who is immune to contracting COVID-19. And obviously, these are critical elements as we manage current infections. But this article is saying that, we should be doing testing at the same time that we're doing these other testing. So I'm going to throw it out to you guys. I mean, what do you think about that? Do you think that's something that could be effective?
Well, I think that it could be effective if it's done right. But I mean, I don't know how they're going to be able to combine it. Like it seems like a big, not enough.
Be a cluster. It could be.
Yeah. I mean, you're going to have people coming. I don't know.
Well, they're saying it would be voluntary, and you could, you could ask about it. I don't know. I think like you said, I don't know how they would necessarily do it. I don't know. But it sounds like an efficient way to do this.
Well, it's nice that they're finally starting to recognize that the mental health and the substance abuse has been put on the back burner during this whole COVID thing. I mean, it sounds like, they're starting to revisit it. Whether this is just a quick fix to shut everybody up, I don't know. But
it's saying that, the article's saying that this could be an important way to prevent morbidity and mortality. I don't know. It sounds like we have a hard enough time with COVID.
I mean, I think you go to the doctor and they're starting to revisit it. They do that little quick screen, those 3 quick questions. Are you safe at home? Do you have, those dark? Yeah. If that's what they're going to be incorporating, then that's kind of they've already been doing that with regular doctor checkups. So maybe, if somebody's going for a COVID test and this is like their last straw, maybe they will save. I mean, because we've been talking about this from the beginning, that suicide's going to go up. We're going to see a lot of suicides. We're going to hear about a lot of suicides that we haven't heard about because of COVID.
Well, and then the numbers of overdoses is rising. So I don't know. Sounds like an interesting way to kill 2 birds at one stone. Was one stone. Kimberly, what say you?
I agree. I think that if anything that heads us in the right direction is good, semantics wise, I don't know how they would implement that. It sounds kind of a little bit convoluted, but if it helps, then I'm all for it.
It's idealistic, but I do think at the same time we're going to have it's a nice thought. It's a novel thought. I just don't know if that's really feasible. I could be wrong, but it's
practical.
Yeah, and And Robin?
Well, if they used the contact tracers, it could just be a few questions, and then they could refer to somebody else, because the contact tracers aren't going to be trained to help people with mental health or addiction crisis.
Correct.
Exactly.
But maybe a way to at least, start the discussion.
The conversation.
Yeah. All right. So that I'm just throwing that out there quickly because we have a great guest today, and Chris is doing her inner jury right now, but that's okay. What are you, on wheels? You look like you look like you were on wheels.
I'm getting my steps in, Andy.
All right, let's meet Robin. Will you do the honors here?
Absolutely. So I met Robin, oh my gosh, I don't even know, many years ago, at an event, mutual event. And Robin started this amazing foundation, The Sun Will Rise. And just the sun will rise is in itself is a very powerful statement. It's like, maybe today is a bad day, but tomorrow the sun will rise. And, she lost her son, Nick, 5 years ago.
Yeah.
5 years ago. And what she's done now is important. She is a foundation that supports families that have lost loved ones to accidental overdoses. And, a lot of families have been alone, have been struggling this alone, and then they lose their child and they're even more alone. And Robin, extends that olive branch. And sadly, her family has grown, with accidental overdoses. So Robin Houston Bean, I would love to give you the floor. You can tell us about your foundation, share a little bit about Nick, and we'd love to hear how you guys are surviving, through COVID, because I know I'm wearing my shirt, the Beanstalk, and that's not going to happen this year, correct?
It's not happening. No, we just found out that we can't do it this year. And that's our major source of funding. So we're going to have to come up with a plan B. So the foundation started because of Nick's death, obviously. When Nick passed, I really hadn't told anybody that, prior to Nick passing, none of my friends knew that Nick had any substance use issues. He was really young and he didn't want anybody to know. So we really were isolated in this world, trying to navigate it on our own. And then when he died, I found my voice because I didn't want it to happen to anybody else. So, I shouted from the rooftops that Nick died from an accidental overdose. And people were shocked to realize that it could happen to anybody, that it could happen to the kid down the street who was a brilliant boy, a really engaged boy. And I think it shook our community quite a bit. So Nick was the kind of person who would embrace anybody that he knew to come into his group and to not be alone. So I wanted to do the same thing with other families. So we started, first I was alone after he died, and I didn't know what to do. Luckily, I have a wonderful sister, and she encouraged me to get off of the couch because I was just
paralyzed. Yeah.
Paralyzed, devastated. I mean, it was shocking. It was the last thing I expected. He had been in recovery for 7 months, and it was the first time he, had been in recovery, and passed away during his first relapse. So it was like a quick thing. We found out he was addicted to heroin. He wanted help because he had tried to quit on his own. Got him into the Mass General Arms program, and he did everything he was supposed to. He signed on so that we could see all the drug tests and talk to his doctors, and everything was going really great. He had become an EMT and really liked the job. And then one day he was dead. Like it didn't the plan of what I thought was going to happen. We didn't understand that addiction is a relapsing brain disease, that he was more likely than not to relapse. I think we were just under the impression, wow, this kid understood he wanted help. He did what he was supposed to, and everything was going to be fine. And it definitely wasn't.
Can you tell us a little bit about how, because one of the things we always talk about is that addiction does not discriminate on neighborhoods and demographics, psychographics, where people are based out of, how much money you have, et cetera. Can you tell us a little bit about Nick and his, a little more about the type of kid he was and kind of your background a little bit?
Yeah, we're a middle class family. I'm a business owner in the town. I own a partner in an insurance agency. My husband is a sheet metal worker, and we have a great house with a pool, and we have a family that has a house down the Cape and another family that has a house down the vineyard. So we had wonderful summers, and we ate dinner every night together. Nick played sports. He wasn't very athletic, but he liked to play sports. And one day, I'll tell you a quick funny story. He was on the soccer team, and he was really good at soccer. And a lot of kids on the soccer team belonged to the boys' gymnastics. It was kind of big in Braintree. And they needed some more kids. And Nick came to us and said, hey, I'm joining the gymnastics team. And I'm like, you don't even know how to do a cartwheel. Like, what are you talking about? He's like, no, I'll try anything once. He went on the team, and then they ended up winning the state championship. So he just will try anything, which is good sometimes, but not so good. He was the kind of kid who took risks and wanted to see what would happen if he did something. So he was brilliant. He took the SATs in 6th grade. So he was a smart kid,
Right.
Great head on his shoulders, but took chances and probably didn't think anything could happen to him. He was voted most memorable in his high school class. He was quirky and funny, and he liked to wear pins with all different sayings like "hug me," and he would wear purple skinny jeans. And
so he was like a well-adjusted kid. Like he was just a all-American kid.
Yeah. He was. I would say he was a little nerdy, but everyone loved Nick. Like all the groups loved him, the jocks, the nerds, the orchestra, the gamers,
he just had a little bit of everything.
Yeah. He was just a well-liked kid. And, but he was depressed. He'd be that funny kid. And then at home you could see there was depression. And I brought it up to the doctor, and he said, I can give you a name of someone for him to talk to. But Nick wouldn't go, and you can't force anyone to you're going to just sit there and not do anything with a therapist. So he wouldn't go, and started using marijuana to help with his depression. He started self-medicating. He didn't really use alcohol, because I had told my kids that alcoholism was in our family tree. So from a very young age, I really drilled in that message. If you drink, you're going to be an alcoholic. I just know it. Don't do that. And so he started smoking marijuana because he believed that it wasn't addictive, and nobody dies from marijuana, Mom. That type of thing. All that marijuana did was make him lazier and not care about things as much. And I think it probably loosened his inhibitions to try other things, because if that made him feel good, well, what's this pill going to do? It might even make me feel better.
When you started to find out about, how did it start for him? Was he a particular crowd that he was running with, or is it just kind of how did it start for him? Or do you?
Yeah, I think the group that he was with, they enjoyed the pot. And I did not know until after the fact that he had started taking pills or anything like that until Nick came to us and told us he was addicted to heroin. Like, it went from, I think I have a kid who smokes pot, to, Mom, I have to tell you something, I'm addicted to heroin. So, you know, I don't know that his friends that he had here were involved with some pills and things like that, but I don't think that they were heavy users. Like, all those kids were very high functioning people. Like, no one was missing work or school or anything like that. I think Nick just had more of an addictive personality. Once he found it, like, he ran with it. And I think it was an isolating thing too. I don't think he was really like a party kind of kid.
How did you address it with him when he told you? Like, what were the, you know, from a parent's perspective? And I'll let you chime in on this, Chris. And
well, gee, thanks, Andy.
Yeah, my heart.
I'm bossy today. I'm bossy today.
You are.
My heart broke when he said that. Like, it was the last thing I expected. You know, how do you go from pot to heroin? Like, what kind of mother am I that I had no idea that happened? Like I said, we ate dinner every night. All I would do was yell at him, Nick, you know, stop smoking pot. You know, like, you messed up today. Like, blah blah blah. Like, I didn't know that I was looking at a kid who some days was in withdrawals and some days was that. You know, like,
I think that goes to the old, you know, it's just pot.
mm-hmm.
And that mentality, like, well, they're just smoking pot. I mean, we hear it now, you know, people that are off the pills and off heroin and they just smoke pot. And it's like, back in the back of my mind, it's like, you're going to do that full circle. I mean, it's inevitable. In the beginning, you had said that, you know, you were a very private family. Do you feel like, you know, you couldn't share with anybody because of the stigma, or was it for fear of, you know, being that parent that nobody would ever talk to again? I mean, that's part of the stigma too, but why did you not share with anybody? Were you alone in this at the time? I mean, 5 years ago is kind of when we were just kind of getting into, and more normal families, quote unquote, we're starting to, you know, we were starting to see the losses of all American families, as opposed to homeless, you know, the how addiction is labeled, you know, it's the homeless, poor, whatever, dirty people that live on the streets. Is that why you didn't share, or did you just not have anybody to share?
It was because of Nick that I didn't share. Probably because of my husband. Nick told us, he said, please don't tell anyone. I don't want anyone to know. And I respected him with that. But it was very isolated. I told, you know, my sister and my family that I felt like they had to know, because I mean, we tell each other, oh yeah, you know, so-and-so's at the doctor's because they've got a cold, you know, so we're a very close family. Like, so I had to tell them that Nick had come to us with that, but he didn't want anyone else to know. And I think that it might've been a relief for me too, to be like, okay, I'm not saying anything, because yes, what kind of mom am I that I've raised a kid who's now addicted to heroin? Might have been in the back of my mind. I know my husband didn't want anyone to know. My husband still doesn't really like that everybody knows our business, you know? And I think it goes to not wanting to be judged for him, for sure.
I work with a couple of different families in Braintree, and I feel like some towns are more closed about it than other towns, you know, and it kind of blows my mind. It's like, you're not alone, you know, but I mean, 5 years ago, we were very alone. 7 years ago, we were very alone. Okay, so tell us about The Sun Will Rise. Tell us about the Beanstalk and how Beanstalk came about. Share a little bit about that.
Yeah, so Shortly, a couple days after Nick died, I found I think I call it his recovery notebook, because it was like a little book that he was supposed to do all his little lessons in when he went to IOP. And in the front cover, it said, "Please be happy, the sun will rise."
Ooh.
Yeah. So I took that. That was his message, right, to himself. I can get better. I can do this, right? It then took it as the message that was left for us. Like, Mom, you can do this. You're going to get through this. You're going to be okay. And I don't want you to cry for me the rest of my life, or rest of my life, I should say. So we started, after a while, I started that grief support group in Braintree. And it took off. The first day, just from word of mouth, there were 8 families that were there. Shortly after that, I'd say 3 meetings later, we had 28 people in that group. And I was like, wow, this is something that is so needed in our area. So we had to expand to a second group. So Braintree, and then we went to Quincy, so we could kind of divide the group in half and give people enough chance to talk, which is what you need at a grief support group, because the death from an overdose is it's traumatic. There's so many things that go with it that just you need to talk about. There's the shame, blame, guilt, fear. There's all this type of stuff. So we expanded. Again to Weymouth, and now this year we have a total of 9 groups. Of course, then COVID hit, boom, ruined that. And now we had to go to a Zoom format. So we've got 6 Zoom groups for grief support, which is amazing to me. And I have a bunch of wonderful facilitators. But along with the grief support, we also decided to do things to help with prevention. And so I've gone and I've talked to a bunch of different places. We've done, talks at schools, and I've talked to like the Gymnastics Association, and the district attorney for Norfolk County has done some great programming for pediatricians. So we talked in front of them to talk about the risk factors that I think I missed and what I think is needed as a pediatrician office. Because I took Nick, I'm sorry, I'm backtracking a little bit.
No, this is great.
I took Nick to the doctors when I thought something was wrong with him, when I found out he was smoking pot the first time. And his message to him was, don't smoke on the weeknights and keep your grades up. That was his message to my kid when I wanted help for that. Yeah, I was bullshit. And Nick walked out of that office like, well, see, Mom, it's no big deal. See, so.
Doctor co-signed on his behaviors.
Yeah, absolutely. And then, so I was mad about that. But then I took him later on when Nick kept being sick, and I didn't realize he was trying to stop on his own, and there was withdrawals. He was being sick. He wasn't obviously telling me. I took him to the doctor. The doctors didn't test him for drugs or anything like that. They told me, oh, it's allergies and bronchitis and this, but I didn't think to ask for a drug test, and they didn't do one on their own. So I really, my messages to pediatricians, be part of the solution, not part of the problem in these kids' lives. When they're 14, 15, 16, do question behavior, and don't assume everybody's just not going to dabble in drugs. You've got to question these kids harder as a pediatrician.
Go ahead, Andy.
Oh, I was going to say, I think, I know a doctor who works for St. E's in Boston or in Alston or Brighton, wherever. And he says that, this isn't your father's marijuana these days. And I wonder if a lot of doctors or pediatricians may not be up on the fact, or people are not on the fact that this marijuana is not, what we had when we were kids. This is a different deal. And, do you think that there needs to be more education on that?
100%. 100%. I'm thinking when I think of my doctor now, I'm like, oh yeah, he was probably a hippie kind of guy back in the day.
Right.
Probably smoked pot on his own. It was it's no big deal. What's this mom freaking out about?
I think, so I know that pediatricians now do talk to children when they go in for their appointments after a certain age.
Teddy Grahams? Okay.
Yogurt melts.
All right.
But I think what they do is they say, okay, mom, step out. We're going to talk to your child. And honestly, do you think, I mean, it's a, right there. It's a once every 6 months checkup. Do you really think that a kid's going to say, hey, yeah, doc, listen, I'm snorting heroin at 14 or 15 or 16? Do you really think I mean, personally, I think that, if you go in and you take your kid in and they've dropped 8 pounds, you need to have a blood test. What's going on? Like
Yep.
that's,
Yep.
are the grades dropping? What's the behavior? They need to pull the mom in the office and say, hey, what's the behaviors going on? Are they still doing A, B, and C? Because when you were here 6 months, 8 months ago, they were captain of this team. They were doing this. Their grades were this. Now, all of a sudden, those are telltale signs.
Yeah, but you know what? There's a when you see this with regular primary care, the average PCP spends 4 minutes with their patients, and that, according to statistics, and they have about a caseload of about 2,300 patients on average a year. They see that many. So, how are they able to see the patient load and be attuned to all this? I don't know if they, which speaks to the healthcare problem, because they have to do it they have to see so many patients because the insurance pays less and less. So they have to do a volume business, basically, is my understanding. So they should be more attuned to it.
Yeah, I feel really let down. I mean, I brought him in. My kid smokes pot. He's depressed. He's sick all the time. He's lost weight. Hello. Somebody help me here. Somebody help me understand what's going on. They're the ones with medical degrees. Like, they need to be attuned. This is a disease just like any other disease. If they know everything about, cystic fibrosis, they should know everything about addiction. And hopefully the kids that are coming out of medical schools now are getting that education that they need.
Better education, but it's too late. I mean, what about the generation that's sick and suffering? What about the grandchildren that were born, that some of us are raising, that were born addicted? What about them? What are we doing to them? I mean, I advocated for my granddaughter at, I think she was 6 when she had her tonsils taken out, and they tried to give her a take-home prescription of Dilaudid. I'm like, no.
Right. Let's hear from Kimberly, because she's been a wallflower. Kimberly, are you there?
Yes, I'm here. I think that there's many good points being made. I think the doctors don't have any education on addiction when they in med school. That's the first and foremost. I mean, it should start there. They should be more aware and more educated about what's happening and how to treat it and where to go. And if not, then they at least need to refer them to a specialist. But yeah, and the fact of Nick not wanting to tell anybody speaks directly to the shame that's involved in this disease. There should be sympathy, not stigma.
So as a okay, so now you going back to the foundation, kind of, you had said, you were paralyzed, or you were having trouble getting off the couch. As what happened that kind of lifted you to start what you're doing? How did that kind of materialize? What was when did that happen?
So it was a few months, and my sister was a big help with that. I had actually been introduced finally to someone else who had lost a son to overdose, and that connection was like a light bulb going off. Wow, she completely understands me. I can say all these crazy things to her that I couldn't say to anyone else because they would think I'm insane, and that's when I understood the value of having someone out there, and to know that I wasn't alone in my grief. And so we started to do things. Actually, Chris, Linnell with Hand Delivered Hope.
Yeah.
That was one of the first things I ended up doing, because one of the moms who lost someone had been talking about her group about helping kids on the street living in active addiction by delivering them,
the backpacks,
food, supplies, resource information.
I went on her first trip and went on many of those, and it was very powerful.
Yeah, very powerful. And you know what? Nick lived a charmed life and was never homeless. But for some reason, to me, it was like, I can't take care of my kid, but I can take care of someone else's kid. So we started doing that monthly, and that really gave me that, I don't know, like that purpose maybe to go out and help others. Helping others helped myself a lot. And then combining it with going to a grief group in Brighton, and that was Rhonda Lottie's group, who was an amazing mom.
She's amazing.
She is like my hero, my mentor, my everything. I love her. And she convinced me that, I could do this group on the South Shore and not have to drive to Brighton to get grief support. So we did that. And then we figured out we needed some monetary help if we were going to do this. We needed to fundraise. So Nick, being very musical, he could pick up any instrument and just play it by ear, which I don't know where he got that, sing a note in tune. And his friend and his girlfriend said, well, instead of doing like a golf tournament or a road race, why don't we do a music festival? And I was like, well, I have no idea how to do that, but okay, let's try it. So we did it. In the first year, it was really small. It was inside Braintree Town Hall. We had about 200 people, but in my head, I just didn't want it to be a fundraiser. Like, I wanted it to help our community. So we had a bunch of resource tables there, and, we talked about addiction, we talked about prevention, and it gave the community like, wow, this is happening in our town. Like this, let's talk about this. Got a lot of newspaper, time and airtime and that type of stuff. So it was great, and we made some money, and then it kind of snowballed. So the last, this would have been our 5th year doing it. It just got bigger and bigger, and we also added at the end of it a vigil, because Braintree has never done an overdose vigil or anything like that. So we also added that into it. And, so the day is a great day because we now have, in between the musical acts, we have people in recovery speaking, because, it's about showing the world that there are so many people living in recovery that we don't hear about. It's a quiet population, so that people understand that even though if you do have substance use disorder, you can go on and live a great, healthy life. And it's just, it's a really fun day. So you get your message out, but people are still having fun, which is something I really like. And think Nick would really, well, he would have killed me because everybody in the town would be there with his big face, a picture of his face. But I think he would really appreciate that. We know we've helped people directly from it. We've had people that have found help at Beanstalk, and I've gotten phone calls the next day. Yep, we did an intake on them last night. We also do scholarships to sober living. So like this person wanted help that night. We were able to scholarship them into a program because they didn't have any money. It's just an amazing time. And it's different.
It's one of those events where you go and it's got such variety that it's not your typical, you go and there's all these resources there. The resources are there, but within the resources, she has these, this place where you can paint messages. And there are other paintings there that are by people that are in recovery. There's a Frisbee toss, she's got the raffles, but they're not like raffles. They're like raffles, like they're amazing raffles. Like the donations and support that she gets for this is insane. She has food trucks, so you can get food. It's an all day thing with great music. Well, some great music. she allows bands that are.
I got a good band for you too.
Yeah, she's got bands that
good
are
sober
like
band.
She's got bands that are like just starting, but you know what? It's okay that they're not that great. It's it's about what they're about. They're in recovery and they're playing music and they've got together, and this is a new passion for them. And it's a way for them to express themselves. So at the end of the day, it's just one of those things that you walk away from and you're like, wow, that was great. And you see so many people.
So
Yeah.
I want to get back up for a second. First of all, Kimberly, do you have any thoughts about Robin mentioning about sober living and scholarships? Do you have any thoughts on that? Being in having a sober living home?
Kimberly? Did we lose her?
Okay.
Sorry, I'm here. I'm sorry.
My question is
that
Robin mentioned that sober living was one of the things that she does with scholarships. Can you tell me about, from your perspective, about scholarships, et cetera, from your perspective,
Yeah.
what are some of your
It
thoughts?
helps. Yeah, it helps tremendously, Andy. And that, people being able to provide scholarships or entities, I should say, so helps the people in need. And when they really want it, you can tell they really want it. And they come in and they do everything you ask, and they're absolutely, they're so grateful to be there. I think scholarshiping from, fundraising, whatever means possible, is so beneficial. And they feel grateful. They feel like somebody cares. It's a win-win across the board. So yes, we've been very successful with scholarships for the girls.
So Robin, to back up for a second, we talked about depression, right? And that Nick had depression. Did in hindsight, I mean, was that something you tried to address?
I did try to address it with him. And we got the name of a therapist, but he wouldn't go.
That's right. You said that, right?
Yeah, I'm not going to get out of the car. So, how do you force a 16-year-old to deal with his depression if he won't deal with it on his own? Like, if I'm giving you the tools, but he won't take them. Frustrating. Very frustrating.
So as moms, right, as Chris, and I know we're jumping all over, but that's me. But as moms, so I've done, this will be my 128th show between my radio show and this show. And I've talked to so many different moms over the course of the past 3 years. And I hear you guys, you ladies, and I'm like ready to start this, go not off the wall, because there's so many stories out there of moms and families that have lost children. And yet, how do we get people to understand that this can happen to anyone? And that if you're, we're so, today there's so many helicopter parents, or we want our kids to do this and that, and we're so attached to them. But yet this is something that is affecting everybody. And I still feel like, why can't we get the support needed to help? And that it's just like, I feel so frustrated. There's so many moms out there that are trying to do really good work and share their experiences. And do you ever get frustrated or feel like it falls on deaf ears sometimes?
Really, Andy?
I'm just asking. I'm throwing out the question.
Of course we do. I mean, I haven't lost a kid, gratefully, yet. That's how I live, gratefully, yet, because that's how this disease works. They can be in recovery, and in a millisecond, it's over. And, my message and Robin's message are parallel, but Robin's lost a child. She doesn't have to do this. And there are so many moms, like you said, that have lost children, because it's not just a child anymore, it's children. And yet you get up every day. You're there for so many. That's where I draw my energy. I draw my energy from if these guys can get up every day after losing a child, then I have no business laying down and saying, we have to. And yes, it does fall on deaf ears, because we were just gaining momentum when COVID hit. We were, after years of banging on the walls. We were just gaining momentum. And now it's drug addiction. What's that? We're on the back burner in the cottage that's a million miles away in a different country.
So what would it look like if you could get the support? See, now to me, right, doing this, it was funny. I had a conversation with my nephew who's a social worker, and he wants to move to New York. He's a future social worker, and he wants to move to New York, and he's got to take $100,000 in loans out to go to social work school. I'm like,
to get paid nickels.
That's what I said to him. I said, so you're going to take $100,000 out. I said, there's a real need in treating substance use disorders, right? And being there for people. I said, there's a real need, but it's like, it doesn't, people are hiding from it. So they're hiding from it. So how do you get corporate America behind it? That's how I'm looking at it. How do we get corporate America behind it? How do we get, there's some very influential people out there. Not that you're not influential, Robin, but I mean, there's some like notable celebrities and people who have lost children and don't talk about it, right? And they have a platform and they're not talking about it. So is it, don't we need those people to build a share of voice? Like cancer, they rally behind cancer, but yet we don't get that from addiction.
So sometimes when I see like, they do they put it on every single channel, like Comedy for Cancer, or, when there's a hurricane or whatever, there's this big devastating thing that happens. It goes on all the channels and all these celebrities are out there with their voices. They've never done that for a substance use disorder.
Nope.
Now they did, and so many of them have been affected by it.
Mac Miller, who died, Mac Miller's, I got connected to Mac Miller's mom. Mac Miller is he was the rapper. Kids love him. There's so much she could do with that, but it's so painful for her. Hopefully she'll get ready. But, if you listen to, his music, when I was telling her, I'm like, there's things you can do without being, let Mac share his stories, through his music, through his, through quotes, through things like that, where you may not have to be out front and center, but still do stuff. And it's easy for me to say because I'm not a parent and I don't have a child in that, but I'm so frustrated. I really am. I'm very frustrated because I probably interviewed or had conversations with maybe 30 moms, 35 moms, honest to God. I mean, we've had several on our show right now, since we've been doing the map, and it's like, it's the same. I'm not being minimizing you, but so many moms have the same story. Yet, how do we build that traction to make a difference? So,
Melissa Etheridge just lost her son, and she was finally talking about it the other day. She was on Good Morning America, and I was like, wow, here's a celebrity that's willing to put themselves out there and talk about this issue. They ended up, you can watch it online, like they only had a short part of it, but you can watch the rest of it, online. And I was like, so glad, like, hey, hello, there's so many more of you out there that have lost children, but
it's painful though. That's the but
I think if you're in a public position, you've got a lot of power to help make change and make people understand what the real situation is out. How many people are not just that we're losing, how many of our kids are addicted, right? Chris, like, that number is unbelievable.
It's unmeasurable. It's absolutely unmeasurable. And like, not to keep coming back to like the whole COVID thing, but when we get out of COVID, we're going to have, and they're predicting like COVID, we're not going to be fully free of this whole COVID on whatever for at least 2 years. So imagine
it may never go back.
Right. I mean, like, yeah, this is going to be our new normal isn't going to, I guess, really show itself for about 2 years is what they're basically saying. Between the masks and the social distancing and everything else, We've got 2 years ahead of us. Think about the people. I mean, Robin, you know, as well as I know, we've been talking about it. The detoxes are full. The CSSs are full. Nobody's talking about the overdoses, but go ahead and look on Facebook every day, 2, 3, 4 RIPs. Back in 2015, when this whole disease started, the RIPs were overwhelming. They weren't as public. 2016, they became a little bit more public. And by 2017, everybody was RIP. Kids knew before parents knew that they had lost kids. There were RIPs on their Facebook pages before parents were even notified that they had lost their children. Like that's what's going to happen. We're going to have a repeat of 2016, 2017. It's coming. It's coming.
I can already feel it because the number of new parents that I have that have joined my group is overwhelming, especially during COVID. And these parents haven't been able to grieve the correct way, you know, with a proper funeral and a proper wake, isolated. It's tough.
It's so painful. It's got to be, I'm sorry to cut you. It's got to be so incredibly painful as parents to go through this. I can't imagine. I don't know. But I know these moms, you included, and Chris, and are so courageous for being on the front lines of this. And it would just be so nice to have some more support for you guys. Right. And that's why we do this show. You know, we're all passionate about it. Like Kimberly said, if people want to help you, or we all want help, but if somebody wants to support your organization, I know that you have the Beanstalk is on hold for this year, but you're looking at doing some other things. If people want to learn more about what you're doing, how they can help you, how would they go about doing such?
They can go to thesunwillrise.org. We have a give page there. You can pay by PayPal or Venmo. You can send a check. We're also going to be doing even though we can't have an in-person vigil this year, we're still going to have a vigil for our community. It's going to be combined with Braintree and Quincy and Weymouth, Tri-Town, that we're going to have people able to go on to Zoom, and we're going to do a little thing. And in the morning, we're going to have a butterfly candle pickup so people can release a butterfly and pick up their candle for the evening. Support for us includes, you know, monetary support, but it also includes being vocal. Like, you support us every time you support someone that's in active addiction, using proper language, you know, asking what you can do to help the community, not putting your head in the sand, promoting, you know, until kids are 21 to use instead of allowing them to use in your basement, you know, drinking and thinking it's, you're the cool mom or dad, you know, like support our, it's not just about money to us, it's about supporting our message.
Building your community. Now, when you know, and this is probably, I don't usually ask this question, but I'm going to ask the question. No, it's okay. No. When you raise funds, where does the funding go to? Like, what are you funding with?
Yeah. So only a small part needs to go to the actual grief support, because we have mostly facilitators that do that. Doesn't cost a lot of money. We just need materials. So like if you're in person and you get surviving the grief of an overdose loss, navigating grief, and surviving the grief of traumatic loss. Like, we have some materials that we give to people to help them, but the majority of our money goes to sober living scholarships, which we put on hold for a little bit right now until we know what money we'll have for this year, because we weren't having Beanstalk. So last year we did $46,000 worth of sober living scholarships.
That's tremendous.
Amazing.
Yeah.
Amazing.
So we were really happy about that. We've also helped, we help the community in different ways. So if a family is really struggling, they have someone in active addiction or something like that, and they need some monetary help for something, you know, odd that comes up, we can help them as well with that. So it's really going to the community that directly needs it. It's for Massachusetts, so we don't say, just the Braintree area because it's where I'm based out of. But there is usually, the tab is off right now, a sober living scholarship application that they have to go through, and you have to be coming from treatment into sober living. And it needs to be a sober living place that I know and kind of approve of, because some of this money I just don't want to throw away on some of these houses.
Do the houses have to necessarily be MASH certified, or if you know the house and it's a good house?
Yeah, I like them to be MASH certified, but if I know the house and they haven't gone through that exact process, I have done that. Requirements, but it is a number of houses that we work with on a routine basis. So that, that's where the money goes. And, a quick story about the Frisbee toss at Beanstalk, because it's like a 50-50 type of thing, right? So if you throw the Frisbee and land on the spot, you get the $1,000. If you get right beside it, nobody lands exactly, you get $500, the closest person. So the person 2 years ago, she was jumping up and down, and she said, I'm so glad I won this, whatever. And yep, here's her $500, off she went. I saw her the next summer when I was doing a table at another event, and she had her son with her. And I said, I want to introduce you to my son. And he came up, he goes, you saved my life. And I'm like, what are you talking about? And he said, my mom didn't have a dime to her name. She won the $500 at Beanstalk and put me in a program that next morning. And I've been sober ever since.
And that's what you do.
Isn't that? Yeah. So I love those stories. I hear from the kids that we've scholarshiped. Not all of them have stayed on the path. Most of them have. So my fingers are crossed. But I love to hear how well they're doing. And what they also do is once they realize that people are out there that love them and support them no matter what, they're able to give back to. They want to pay it forward. So that's a really nice thing.
Thank you. That's awesome. And you really are doing great work. And we really appreciate you coming on today because, we always want to hear from people like you who are making a difference and really trying to, be out there sharing your story. It's very courageous. So can you give your website again?
Yep. thesunwillrise.org.
Excellent. Well, that's our show for the week. And I really appreciate it. Kimberly, any closing thoughts?
Just want to remind people we do the podcast to help reduce the stigma and be of service to anyone struggling. We've got an entire network of professionals, and we can help you find the right fit. So reach out to us on our Facebook page or at the numbers that you see during the podcast. And that's it. You've been listening to The Map. Thank you so much, Robin. And we'll see you all on Wednesday at 11.
Take care, everybody. Have a great weekend.
Thank you, everybody.
Thank you, Robin.
Bye.
Bye-bye.
Bye. Thanks. Bye-bye.
Bye.
Bye.